Hi, this is Dr. Cash, Dr. Cash Medical Life. Today I'm going to touch a little bit about physical examination and why it is still matters. Um, the topic today is physical examination matters, what still matters. And with this day and age of so many modalities of imaging studies, lab tests, and different kind of techniques in diagnostic of diseases, sometimes we as physician or healthcare provider may take a little shortcut and may not be as dependent on physical examination that we were so accustomed to as we went through our training. And so today I'm going to just touch base on why physical examination still matters. So I got an elderly guy right now. He's still in the hospital. He's 83 years old, and he came into the hospital actually about 4 days ago. That was his first visit to the emergency room, and he was having like chest pain. Didn't really have any kind of trauma. And he just said he woke up, lots of pain. He's elderly, so he's a little bit demented, but most of the time he's still clear, so able to give a pretty decent history. Nonetheless, he was evaluated in the emergency room. He had a panel of lab tests done, kidney, livers, lab counts. Everything looked superb. And he had a CT angio of the chest, looking for blood clots in the lung and other pathology, and things cleared up, pretty good. So he was actually sent home. And then 2 days later, last night he came back. He was like, man, I was just in so much pain, couldn't take it. So he came through the ER again. And this time we also did a whole bunch of other tests, a CT scan of the abdomen, and repeat another chest x-ray, a whole bunch of lab tests, and everything looked actually pretty pristine. And so we're not sure why he kept having this chest pain. Clearly it wasn't a heart attack because his EKG and his lab tests looked okay. And then when I went and saw him, he actually was quite, on my examination, tender over his mid-axillary, midline over there, just right a little bit behind the rib cage there, quite tender. And so based on that examination, with the previous history of negative CT scan of the chest, still my suspicion for a rib fracture was still pretty high. So further evaluation showed that indeed he has a little bit of a bruise there, not very apparent, but clearly there was a bruise in that general area. So he must have sustained some kind of trauma. So we went ahead and we repeat the x-ray again. And this is the fourth time. The first time was a CT angio of the chest, which was looking, particularly CT of the chest, looking for any blood clot, pneumonia, or any fractures, and then a CT of the abdomen, and then a plain x-ray, chest x-ray, and now we specifically focus on just the ribs. And so we did a rib series on focusing on the area of the tenderness, and sure enough, he was found to have 3 broken ribs in the area, just slightly shifted or displaced. So perhaps because the fact that it didn't shift, those fractures did not shift too much, so they were not apparent on the other imaging studies. But nonetheless, at least we're able to find the cause of his pain and explain that to him. And now we have to move forward to explain why he developed those fractures. And so we'll be doing some work on that. But at least in this situation, a very focused physical examination, despite what all the other tests have shown clinical suspicion in clinical judgment still is very important, and finally getting to the final diagnosis, having a good explanation for the pain, and so that he can move forward. And so hopefully his pain will get a little bit better. We'll treat his pain, improve his breathing, and we will be searching for the cause of his broken ribs, which can be as a result of a weak bone density related to osteoporosis or cancer or some other things that we'll be searching for. So this is just to prove the point, the physical examination still matters, still is very important, despite all the other tests that we have done, lab tests, multiple CT scan and plain x-ray. If nothing just doesn't fit, but your physical examination really points to a certain diagnosis, chase after that. And in this case, at least, we were fortunate to find the explanation for this gentleman's chest pain, and hopefully he'll recover soon, okay? Well, so thank you for joining, and next time if I find something interesting, we will see you again next time. If you have not subscribed, please do so. Hopefully see you next time. Take care. Bye.